My Doctor Said What is a program for health information. Be careful that if you want treatment and diagnosis of disease, you need to go to your local healthcare provider.
Hi, this is Dr. Frank with My Doctor Said What? Some plain talk about your health and wellness and what your healthcare provider said and what it means in simple terms so you can have a better future 2023, 24, and beyond. A couple things I want to tell you. I've talked about how being on the other side of the patient paradigm works for doctors. All doctors become patients at some time. And I was reminded the other day, I live in a rural area. Thank you, Ag Credit. But I have to go about 35 miles to a major academic health center to do some more in-depth clinical tests I did recently for my cardiac health. And I was reminded of how patients feel and the intimidation of white coat syndrome. I went through a series of registrations from one end of the hall down to the other. So finally I got to the window that I thought was going into the radiology department, and the woman there said, strip down and face me. And by the time my pants hit the floor, she looked at me and said, no, sir, this is registration for radiology, the third registration I've been through, and that's your credit card I'm talking about. So I definitely felt some intimidation, especially when I looked around the room and the 4 or 5 people sitting there were not clinicians, but other patients. So if that helps you any to feel better about your angst when you go to the doctor or your healthcare provider, hopefully that'll make you feel a little better. I definitely knew how that felt. So I'd like to talk about a couple things today. So a couple quick and fun facts. One thing I wanted to touch on, just because it's in the news a lot, is mental health, and we're going to have some experts here in the coming weeks. And I want to thank all those listeners. We've had over 15,000 listeners in 8 weeks. So that's a wonderful thing. Thank you. Haven't had a lot of YouTube videos. People don't like to look at my face, apparently, and that's okay. I don't either. But I'd ask you right now to share and to pass it along. My Doctor Said What with Dr. Frank. And hopefully we can come up with some health tips and some interpretations of health results that are useful for you. Medical marijuana. Medical marijuana, a hot topic in many places, and I have been involved in research and submittals to the FDA for years on clinical trials, etc., on different various uses of medical marijuana, THC being the active ingredient, the psychotropic ingredient. And I can tell you this, be careful of things like CBD, that they're not regulated, you got to watch. But as far as medical marijuana, things like glaucoma or epilepsy or chronic pain, marijuana has been shown to have very few side effects and have some fairly good analgesic or pain reducing properties with fairly low side effects. A lot of people self-medicate with alcohol, and believe me, the marijuana is the better way to go when it comes to that for those kind of medical conditions. And hopefully you're looking to your healthcare provider to provide a prescription for that if you have a legitimate need. One thing I will caution you against, the developing brain, during adolescence and formative years in your teens, before your brain is fully developed in the early 20s, 22, 23, 24, I would recommend not using marijuana in any form of THC, including medical marijuana, because it can change the brain chemistry of the developing brain, cause lack of motivation, cause all kind of issues that really are long-term, long-lasting, and that aren't helpful. So again, you always look at the benefit of the drug versus the side effect. And you've got to do that analysis before you take anything, and including those that you talk to about your healthcare provider. And if you're uncomfortable, as I said, get a second opinion. Research for yourself before you get the second opinion. Ask intelligent questions. And if you don't think they're intelligent, ask the questions anyway until you feel like you understand what's going on. Eye health, something we don't think about a lot. I've thought about it because for the first time in my life, I've had to wear glasses for the last year, mild prescriptions, and the glasses did not improve my vision as much as I'd hoped in low light. And I found that as most people my age, I'm developing cataracts. I've been careful my whole life, and I'm going to tell you right now, wear sunglasses, nice polarized sunglasses, ones that say UVA 400 or UVA and UVB protection. It's really important because the sun, the ultraviolet radiation, just like it's hard on your skin because it disrupts molecular structure and can cause skin cancer, skin issues on your delicate tissues of your eye. It's really a problem. So wear your sunglasses. Also, common thing, don't put your fingers on your eyes. That's how you get all kind of pathogens introduced to your body. Your mucous membranes, your eyes, your nose, your mouth. You want to be careful. Do not stick your hands on those. Don't touch your face. That's why you have issues with acne a lot of times. You're putting bacteria on your face, and that ends up with the wax and oils of your pores, creating acne. So for your eyes, though, you really got a problem. Don't ever rub your eyes. You can cause problems. You can cause scratching of the lens surfaces that are so delicate, all those kind of things. You do not want to do that. And for those contact wearers, change your contacts regularly as prescribed. Don't sleep in them and don't swim in them. Very bad, very, very bad. You can do some real serious damage to your eyes. You only got two eyes. And although we have some incredible surgeries these days, like LASIK and some things to reduce glaucoma that are fairly simple, having more tear duct flow, all those kind of things, talk to your ophthalmologist and have a yearly eye appointment. A yearly eye appointment. Every 2 years, if you're below 50, beyond 50, I would say every year is very important. You, again, don't want to have a issue with your eyes that becomes a long-term issue and reduces your ability to enjoy life to not uh, having good sight. So be careful with your eyes. And again, don't touch your face. Don't pick your nose. Don't touch your mouth. Don't do those kind of things for a number of reasons. That's the best way to spread germs, and you wonder why you get sick all the time. You touch a nasty doorknob, your steering wheel full of bacteria and viruses, uh, the flusher on the toilets, all those things. And then you touch your mouth or your eyes or your nose, you're directly introducing those pathogens or disease-causing organisms into your body. Don't do that. Wash your hands frequently. Don't touch anything around your face. If it's a nervous habit, don't do it. Also, get a yearly hearing test when you're over 50. Hearing usually has degradation, and many, 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 many people, more than not, develop tinnitus or tinnitus, and that's the ringing in your ears. And that is a problem that is more of a brain function than an ear function, but you need to have things checked out to make sure you're not having some underlying disease. We tend to go check our ears only when we go to our general practitioner, and that's because we have an ear infection or something. I'd ask you to check them early. And you say, boy, you talk about a lot of preventative care. I'm telling you, prevention's cheap, prevention's effective, beats the cure, reduces the pain, and increases the healing. So you want to do that, whatever you do. So, and then we're going to talk about a few other things here. I talked about supplements last week, and again, if you have a good diet, you only need a good one-a-day vitamin, plus iron if you're a woman, or if you've got iron problems as a man. I really am a big fan of flaxseed oil from omega 3s and 6s. It's really a natural, wonderful thing. If you don't eat plenty of salmon and tuna and eggs, things with omega 3s and 6s, healthy fats, then you're going to need to get that, put it in your yogurt or your low fat yogurt or in your 1% chocolate milk or whatever. And it's pretty easy. It doesn't take much. A tablespoon a day or teaspoon is an incredible difference in how you'll feel. Your skin will look better, your hair will look better, and you'll actually feel a lot better. It'll help you. It's good for your heart health. The other thing is I'm a big fan of eating different lentils, beans, and nuts, because those are good fats. Those are the good fats that fill you up and do wonderful things for your skin, your hair, and for your general health, for your cardiac health. And that's a wonderful thing. Drink plenty of water. Now, I don't think anybody in the world, well, I won't say anybody in the world, you can't say that, never or always, but most people are not going to drink 8 full glasses of water a day. But you need to drink plenty of liquid that's not caffeinated or doesn't have sugar in it, whether it's unsweet tea or some other drink you like, or water is a great thing if you'll drink it. And when it comes to water, I'd say this: if you're drinking a lot of water, especially at home, the carbon filters are really a small reverse osmosis system. Is the best thing you can ever invest in your home. It takes out all the things that the water company can't afford to treat, and our water treatment facilities do a great job, but there are still in areas some pretty rough water. And so if you have a reverse osmosis system, or at least a carbon system, it takes out a lot. You change the filters regularly, not terribly expensive, and very easy to mount under the sink where you get your drinking water. So I'd encourage you to do that. It's really simple, and it pays great dividends in your health, and you really should drink quite a bit. It makes a huge difference in your kidney health, liver health. It's just really important in your overall health. It will help your urinary tract, reduce infections, do a lot of great things. So with that said, other quick tip is be careful of the shampoos you use. A lot of shampoos contain some really rough ingredients that aren't necessarily that great for you. The simpler ones, if you look them up and look at the ingredients, do a little research, are far better for your health, because your hair is one thing as toxicologists and pathologists we look at autopsies and that to see your collective exposure to different toxicants or poisons, and the hair directly absorbs quite a bit in the scalp if you're shampooing with some things that have some fairly nasty stuff in them. So keep that in mind. Same way we look at nails, and a lot of times they're a good reservoir of your general health. Your nails should look good, feel good, not be brittle. So you need to look at that. It's really important, and it's a good indicator of your overall health. One of the things you do, a simple test too, is push on your finger like that. And you'll find that if you just push down on your fingernail, it should go from pink to white when you push right back to pink. Your extremity circulation on your toes and hands, it's a quick test that says, I've got pretty good blood flow down there, and that's really important. And I've said this before, for men, one of the earliest signs of having circulatory issues, arterial sclerosis, hardening of the arteries, as they used to call it, lipid deposits in your arteries that may lead to heart health issues and stroke. A good early warning indicator is erectile dysfunction. If you start getting erectile dysfunction, especially in your late 30s or early 40s, and even in your early 50s, you need to talk to your doctor, explain it, and make sure that you're not having overall health issues. That's really important. Mental health, as I said, and I'm going to close with, this is just quick facts, but the major problem we're seeing is isolation. I've touched that before of people. Isolation. It's kind of like school shootings. It's really a well planned out suicide tactic, and it's sad because it's accumulation of people that are isolated or bullied or whatever. We find that the less social interaction we have and the more online interaction we have in place of that, really isolates us. The other thing is, I think people have lost purpose. Whatever your beliefs are, and like I said, I'm a Christian, but whatever your beliefs are, you need to have a higher purpose, a purpose that's beyond yourself. To really have great self-esteem, whether you want to help feed the hungry or help reduce poverty or be involved in social activism where you're you're against different types of prejudice. Those kind of things outside of your own self and what you take care of will really help you, because studies have shown that people have become less social. They've stopped going to things like organized churches, and it leads into exercise cults and cults that are, based on fitness. And I'm not saying fitness, exercise, I'm all for, but things where there's unhealthy interactions that are all about you and about your life. And you need to take care of you, but one of the ways you do that is to be involved with other human beings, to physically, actively be socially involved, whether you're in the bridge club, you're in the basketball league. And also be careful. A lot of times in our culture in the U.S., we've replaced cooperation with competitiveness. We used to play. Kids played. They went outside, used their imagination, and they played together and worked out problems and did things, at recess in schools. Now, with video games, that we're trying to win. We go to the basketball tournament, baseball tournament, soccer tournament, we want to win. We're not so concerned about the team as we are about our performance, because our performance, we're told, is what matters. Your performance in your mind and your emotions is going to be much better if you learn to work with other people, and that you have team efforts, and you are humble and give credit to others, and it makes for a healthier, happier life. With that said, in the end of my 9th episode, like I said, we've had over 15,000 listeners. Got to get those YouTube views up. Please share if you think it's useful. If you don't, tell somebody you think it's horrible. In a nice way, I pray. But I just ask you to share, and hopefully we can help somebody have a better health and better wellness 2023, 24, and beyond. Have a healthy, happy, long life. This is Dr. Frank with Frank Talk, plainly telling you how you can improve your health. Have a great day.
Remember, send your comments and questions to Dr. Frank at mdswpod@gmail.com.